Healthcare is becoming more and more complicated, and the healthcare delivery systems are changing.
You know, there are things that impact the patients that community health centers serve that span beyond health. We have education challenges.
We have people who have housing challenges. We have people who have food challenges.
We have 18,000 patients and 96% have incomes below 200% of federal poverty.
The fact that the cost of healthcare today continues to go up is a problem. It is a big challenge.
Our healthcare system is fragmented and our underserved populations suffer more than other populations.
I think that it's really important for an organization which is representing a consortium of community clinics to play a bigger role in advocating for the needs that they're seeing on the ground and to be able to bring the voices of the patients to the powers that be that make decisions that impact our services.
We live in Silicon Valley. It's a global village. The needs are diverse of the populations, and we need a diverse network that can address all the multiple set of needs in a culturally competent manner.
It's easy to control costs by denying people care. We have to control costs to limit the extent to which costs increase while providing very high quality care and taking the well-being of patients into account. And by responding to that challenge, it will be able to move into the real future, the next step of healthcare in this county and in the United States.
Oftentimes when you have intractable problems, it's very easy to say, oh my, we can't, this is hard, we can't do it. That's not the way we approach it here. And so I think CHP is a good example of people saying, okay, we have these following challenges, here's how we're going to collaborate and make this work. And it does work. And it's a good example for us all that you should never say you can't, just say how.
The recent community health centers came to be in the very beginning, 60 plus years ago, was because folks did not have access to care.
The providers in other counties were kind of at each other's throats. They were the state of war, and we really, all of us, both the public sector as well as the nonprofit sector, tried to avoid that.
One major catalyst was definitely managed care, because when you have a huge cannon at your head, perhaps you make friends in new ways, and we did.
Thanks to the Community Health Partnership, there is an increased focus on quality improvement, measuring patients' health outcomes, and sharing that data so that other community health centers can benefit.
Our focus is on providing culturally responsive services. So whatever culture a patient comes from, we're looking at being able to serve their language needs and also be sensitive to the cultural implications of the treatment that we provide.
The partnership has the resources to be able to think even more strategically about what's good for the community as a whole, and then can move forward in advocating successfully on behalf of all of its members. One of the most important aspects of the Community Health Partnership is that it is the go-to resource for federal, state, and local policymakers, for health systems, for other community organizations, and for the member health centers themselves.
CHP is a leader in advocacy. They are a leader in data aggregation and in data analysis. They're a leader in problem solving. If 10 different organizations are going to a supervisor and saying 10 different things, that's relatively easy to dismiss. If 10 organizations are united in their presentation of the issues and problems and their view of the solutions, that is much more powerful.
The advocacy of one voice enables us to be very clear with our legislators about not only the needs of our clients, but also in the case of funding, the funding needs and the impact of that funding on our ability to do our job.
When legislators are thinking about legislation, considering legislation, they often call us to ask us, what do you think about this? Would you support it? How will this roll out in your community? What will be the impact? And we're very fortunate that we've developed that trust with our local legislators as well as state legislators.
We've always, as community health centers, have tried to help people make a better lives for themselves. And what we do is we connect. So if we can't provide the service, we also try to connect them to food, we try to connect them to housing, we try to connect them to transportation. And it's really what we're calling now the social determinants of health.
The community health centers run by leaders like Linda and Raimundo are more than centers of primary care, centers of medical service. They are the center and often the heart and the pulse of a neighborhood.
Health is the single most important thing that we can do as professionals, but it happens within a community and political context that we need to have the partnerships and the sources of trust in those communities that can actually deliver the high quality care and service that we've been talking about.
When you hear about the Community Health Partnership, you really hear about their commitment to serving the patients in this community and looking out for those that otherwise don't have access to care. So we're very, very fortunate.
We have primary care clinics that would be the envy of anybody, and that's the kind of quality we strive for.
With community health partnerships, leadership, and support, we've been able to extend primary care health services to the remaining uninsured in the county, the folks that were not able to get insured through Affordable Care Act.
I really am proud of the work that we've done. Whenever we get any limited amount of resources we may get for the consortium, they can turn it over and stretch it, and the value that comes from just $1 of investment in the organization is more than tenfold. I would say it's more like 30-fold.
Reflecting on CHP's success over the last quarter century, I see the fundamental principles of patients first, healthcare to all regardless of ability to pay, and ensuring that patients comprise 51% of our federally qualified clinic boards. In 1993, two great minds saw the need to unite in order to address the demands of managed care. Linda Williams and Raimundo Espinosa created a partnership with local government to provide community-based medical care. Together, we stand today as CHP. Together, we speak with one voice. My name is Dolores Alvarado. I'm the CEO of Community Health Partnership.
So my name is Sarita Kohli, and I'm the president and CEO of AKI.
My name is Zoe Lofgren, and I am the Congresswoman representing the 19th Congressional District.
My name is Sonia Tednasky, and I'm the Chief Executive Officer at the Indian Health Center of Santa Clara Valley.
My name is Paul Lorenz. I'm the Chief Executive Officer for Valley Medical Center.
My name is Kent Imai, and I'm the Chief Medical Officer for the Community Health Partnership.
My name is Rene Santiago, and I'm the Deputy County Executive and Director for the Health and Hospital System in Santa Clara County.
I'm Bob Brownstein. I'm Strategic Advisor at Working Partnerships USA in San Jose.
Hi, I'm Michelle Liu, CEO of the Health Trust.
I'm Rhonda McClinton Brown. I'm the Executive Director of the Office of Community Engagement within the Center for Population Health Sciences at Stanford University.
I'm Linda Williams. I was, for 29 years, the CEO of Planned Parenthood Marmonte.
My name is Raimundo Espinosa, and I'm the CEO of Gardner Family Health Network and Gardner Family Care Corporation.
Together, our 10 community health centers, in partnership with the County of San Mateo, the County of Santa Clara, and all of our other nonprofits, we need to continue to work together to create the best system of care for both our counties.
We're looking forward to the next 25 years to continue this partnership and continue the innovation for every resident in our community.
It's important not to recognize when things are impossible, because sometimes you can then do the impossible if you don't notice that it is.